What if I told you that the medication millions of diabetics take every day might be secretly protecting them from cancer? Or that this same pill could potentially extend your life by 5 years? Or maybe it's slowly damaging your body without you knowing it. Today, I'm going to reveal the shocking truth about metformin, the world's most prescribed diabetes medication that 130 million people take daily. And I guarantee that what I'm about to share will leave you stunned because most doctors never tell their patients these critical facts. Before we dive in, if you're taking metformin right now or know someone who does, this might be the most important video you ever watch. So hit that like button, subscribe to Breaking Diabetes, and turn on notifications because the information you're about to learn could literally save your life or the life of someone you care about. Comment below if you're currently taking metformin, how long you've been on it, and where you're watching from. Let's build this Breaking Diabetes community together. The ancient origins of a modern medicine. Did you know that metformin comes from a flowering plant? That's right. The beautiful purple-petaled Galega officinalis, or French lilac, has been used to treat various ailments since medieval times. This folk remedy was believed to improve immunity, treat constipation and diarrhea, increase milk production in nursing mothers, and even address diabetes symptoms like excessive urination and thirst. While metformin was discovered in 1922, that's 100 years ago, it wasn't until the 1950s that a French doctor discovered it actually improved glucose levels. They thought it ate glucose, which is why it was named glucophage, glucose eater, like a medical Pac-Man hunting down sugar in your bloodstream. Metformin has been in use for over 60 years and is the first-line drug for most cases of type 2 diabetes. According to the Diabetes Prevention Program study, pre-diabetics who took metformin 850 milligrams twice daily reduced their risk of developing diabetes by 31% compared to placebo in less than 3 years. If this ancient plant-derived medicine has been around so long, why are there still so many questions about its safety? That's what we're about to uncover. How does metformin actually work? So is metformin really eating sugar like Pac-Man? Not quite. Here are the three main mechanisms through which metformin reduces blood glucose levels. 1. It acts on the liver, inhibiting gluconeogenesis, basically preventing your liver from easily increasing blood sugar. 2. It reduces glucose absorption through the intestines. 3. It improves glucose utilization by increasing cell sensitivity to insulin, reducing insulin resistance. If you take metformin, you might notice your HOMA-IR score, a measure of insulin resistance, decreases on your blood tests. That's metformin doing its job. Drop a comment below if you've noticed improvements in your numbers since starting metformin. I'd love to hear your experience. When should you be cautious with metformin? Let me be very clear. Metformin is generally a safe medication, but like all medications, it has potential side effects and should always be prescribed by a doctor who weighs the risks versus benefits for your specific situation. You should be more watchful for side effects if you have a liver disease, kidney disease, a heart disease, a recent heart attack, a previous adverse reactions to metformin. If you have any of these conditions and are taking metformin, make sure to like this video and share it with others who might be in the same situation. Knowledge is power when it comes to your health. The side effects they don't always tell you about. Now let's talk about those side effects. The most common ones are gastrointestinal, a nausea, a vomiting, a stomach pain, a loss of appetite, a diarrhea, which usually improves with time, a metallic taste in the mouth. Can metformin cause hypoglycemia, low blood sugar? Yes, especially if you're using other diabetes medications alongside it, though metformin alone carries a relatively low risk of hypoglycemia. The most dangerous side effect is lactic acidosis, a rare but serious condition that can occur particularly if you're using contrast agents for imaging tests, have serious kidney or liver problems, or consume alcohol. Speaking of alcohol, heavy drinking increases your risk of lactic acidosis and hypoglycemia while on metformin, so limit your alcohol consumption if you enjoy a drink. If you've experienced any of these side effects, leave a comment below. Your experience could help someone else in our Breaking Diabetes community. The vitamin deficiency every metformin user should know about. Here's something critically important that your doctor might not have mentioned. Metformin can cause vitamin B12 deficiency. I always order a B12 test for my patients who take metformin, and I've seen countless cases of low B12 levels requiring supplementation. Symptoms of B12 deficiency include anemia, paleness, vision problems, tingling sensations, weakness, mouth ulcers, even dementia. I cannot stress this enough. If you're taking metformin, make sure your B12 levels are checked regularly. This simple blood test could prevent serious neurological complications. Has your doctor ever checked your B12 levels while on metformin? Hit that like button if this information was new to you, and share it with anyone you know who takes this medication. The surprising benefits that will leave you relieved. Now let's move to the good news, the benefits that make metformin one of the world's most widely used and effective medications, earning it a place on the WHO's list of essential medicines. 1. Improved blood glucose. As mentioned earlier, metformin improves your blood sugar, manages diabetes, reduces your risk of developing diabetes if you're pre-diabetic, and reduces insulin resistance. This is hugely important because an estimated 40 million Brazilians, and comparable percentages in other countries, are pre-diabetic with a high risk of developing diabetes within 5 years. While lifestyle improvements like better diet, exercise, cutting sweets, and weight loss are crucial, metformin can significantly reduce your risk if prescribed for prediabetes. Metformin restores your cell's sensitivity to insulin, meaning your body absorbs blood sugar more efficiently, giving your pancreas a break from producing excessive insulin. It also prevents glucose spikes that damage blood vessels, kidneys, eyes, proteins, nerves, and neurons, essentially slowing down your biological clock. Consider this shocking statistic. Nearly 4 million people die annually due to diabetes, far more than from COVID-19. Diabetics die from heart attacks, strokes, pneumonia, Alzheimer's, urinary infections, kidney failure, and infected ulcers. If you're struggling with diabetes or prediabetes, please share this video. This information could literally save lives. The 5 unexpected benefits of metformin scientists are now discovering. In recent years, we've discovered other remarkable benefits of metformin beyond glucose reduction. 1. Anti-cancer effects. 2. Anti-aging properties. 3. Cardiovascular protection. 4. Neuroprotection. 5. Treatment for polycystic ovary syndrome, increasing chances of pregnancy. Let me explain each one, and I guarantee number 1 will shock you. Does metformin reduce cancer risk? The first discovery of metformin's potential anti-tumor effects came in 2001 in a mouse study. 2 groups of mice were given a pancreatic cancer-causing agent for 42 weeks. A 50% received a high-fat diet plus the cancer-causing agent. The other 50% received the same high-fat diet, the cancer-causing agent, and metformin. The results? In the non-metformin group, 50% of mice developed pancreatic cancer. And in the metformin group, 0. Not a single mouse developed cancer. Yes, these were mice, not humans. But this caught researchers' attention, leading them to evaluate a Scottish population taking metformin for diabetes. This population had 23% less chance of cancer than those not taking metformin, particularly less colorectal, liver, and pancreatic cancers. And those taking metformin also had reduced cancer mortality. A recent meta-analysis of observational studies concluded that metformin reduced cancer incidence by 31% and cancer mortality by 34%. While these aren't double-blind randomized studies, the gold standard, the evidence is compelling. A 2022 double-blind randomized study found that for breast cancer overall, metformin didn't reduce risk. However, for the aggressive HER2 subtype, metformin did reduce mortality risk. More studies are needed, but this requires pharmaceutical industry or government funding for billion-dollar studies. Interestingly, of 26 mouse studies with metformin, 25 showed protection against cancer. Again, these are mice, not humans, but the pattern is striking. If you know someone battling cancer, especially pancreatic or breast cancer, share this video. While metformin isn't approved for cancer treatment, this information could spark important conversations with their healthcare providers. Can metformin slow aging? Could metformin reduce aging and extend life? Harvard genetics professor David Sinclair believes so, even taking it himself and giving it to his father, despite neither having diabetes. I find this recommendation in his best-selling book, Lifespan Irresponsible, as metformin has potentially serious side effects. Why does Sinclair believe metformin might reduce aging? First, population studies show that people with well-controlled diabetes taking metformin lived healthier lives than other diabetics, in some cases better than non-diabetics. Mouse studies showed metformin increased lifespan by about 6%, which would translate to roughly 5 years in humans. But was this due to weight loss from metformin? And how might it reduce aging? Metformin limits mitochondrial metabolic activity. The mitochondria sense low energy and activate an enzyme called AMPK, as well as CRT1, which improves cellular epigenetics. While metformin increased lifespan in nematodes, it didn't in fruit flies. Studies on metformin and human longevity are underway, but results will take decades. If living longer interests you, hit the like button and tell me in the comments what other longevity topics you'd like me to cover on Breaking Diabetes. Weight loss benefits. Metformin reduces hunger, causes gastric discomfort and diarrhea, and alters gut microbiota, increasing bacteria beneficial for weight loss like Akkermansia mucinifila and lactobacillus, while reducing those that promote weight gain. For people taking antipsychotics for psychiatric conditions like schizophrenia, which commonly cause weight gain as a side effect, metformin helps reduce this weight gain. Treatment for polycystic ovaries. Polycystic ovary syndrome typically affects young women. The ovaries develop multiple cysts causing menstrual irregularity, facial hair growth, difficulty getting pregnant, and worsening blood glucose. Metformin helps regulate menstruation and fertility, prevents weight gain, and improves glucose levels. Share this video if you know someone struggling with PCOS. They might not know that metformin could help. Additional benefits. A study of over 41,000 elderly metformin users showed metformin reduced the likelihood of a dementia by 4%, a cardiovascular disease by 19%, a frailty by 24%, a depression by 16%. These numbers are remarkable, especially considering metformin is available at public pharmacies or costs less than $2 per box in many countries. Is metformin right for everyone? Should metformin be put in the water supply? Of course not. It's a medication with potentially serious side effects that many people don't tolerate well, even when it might be the best option for them. If you have diabetes and need metformin to help control your blood sugar, its potential health benefits are quite interesting and not harmful as many people claim. So if your doctor has prescribed it to treat your diabetes or prevent your prediabetes from becoming diabetes, embrace this medication. But if you're thinking about taking metformin to prevent cancer or increase longevity without having diabetes or prediabetes, I wouldn't recommend it. You don't need medication for that. Eating fruits and vegetables reduces your cancer risk. Exercising at least 150 minutes per week reduces your cancer risk, cardiovascular risk, stroke and heart attack risk, increases muscle mass, and reduces frailty, all of which are well-proven benefits without medication side effects. So metformin should only be used by those who truly need it. If you've made it this far in the video, you now know more about metformin than 99% of people taking it. Did any of this information surprise you? Let me know in the comments. Like this video if you found it helpful, and share it with people who take metformin. This knowledge is too important to keep to yourself. Don't forget to subscribe to Breaking Diabetes for more evidence-based information about diabetes management, prevention, and treatment options. Turn on notifications so you never miss our new videos. What diabetes-related topic would you like me to cover next? Leave your suggestions in the comments below. This is Breaking Diabetes, where we're breaking down barriers to understanding diabetes one video at a time.